is available. Also happening right now, Hartford HealthCare is joining Connecticut College to make what they are calling a major announcement. Let's listen into that.
August 24th, for the first day of classes. We have been at work daily for the last 2 months and determining how we do that best in order to maintain the health and safety of our students and our workforce. And that involves then some very innovative ways that the faculty will be delivering classes both on campus, remotely, and in hybrid formats over both 7 and 15-week terms. So there's a lot of work. Faculty are right now doing a lot of their own preparation to be prepared for delivering instruction in some new and innovative ways that will preserve the excellence that Connecticut College is known for.
It's Frankie again. Can you just provide any examples of the kind of things you're doing to return students to school, cleanliness, things of that nature?
Oh, yes. Well, all of the classrooms are being considered redesigned. We're actually partnering with an architectural firm to determine how we should best use space so that there's enough air volume and a lack of density in the classrooms. We're opening up new spaces for teaching that will be available. We are redoubling our efforts for cleanliness in the residence halls, and we have a new plan for the way students will be using some of the facilities in the residence halls to preserve their own safety and security. And I could allow Dean of Students, Victor Arcelis, to say a little bit more about that if you'd like to hear.
Sure. So we are making adjustments to how we house students. We aren't we're de-densifying spaces, so we won't be having triples and quads. We're going to be housing students in peer groups, enabling them to be closer to friends, not having to go into other residence halls because they're going to be restricted to just their residence hall. Collaborating across campus with facility staff, dining staff, really redesigning the whole student experience in a way that supports social distancing, while at the same time creating opportunities for students to gather and to connect with each other in ways that are still part of what it means to be residentially on a campus, but doing it in a safe way.
And I guess I should also mention that we have plans for a fairly aggressive testing regime for all students and faculty and staff who are facing students on a regular basis. And so this will go beyond the recommendations from the state, and we're really grateful to have HHC as a partner in this as we seek to maintain the health of the campus.
Any other questions? Very good. Again, we thank you.
It's Frankie Graziano from Connecticut Public Radio again. If somebody else is going to ask any questions, I'll ask one. Any idea regarding this monitoring infectious diseases? I understand that you just said, President Bergeron, about fairly aggressive testing. Will Hartford HealthCare help with that testing? Just give an idea of how maybe the network can help you mitigate the spread of COVID-19 on campus?
Yeah, well, I'm going to let Victor take up the details. The plan right now is for us to teach students how to test themselves and to do that on a basis that is something like twice a week. And yes, Hartford Health will help with that. Victor.
Hartford Health is going to be working with us on establishing all of our protocols. In fact, I have a meeting later this week with one of their infectious disease experts and thinking through all of the strategies.
All right, you were just listening to officials from Hartford HealthCare and Connecticut College talking about plans to safely return to campus.